Welcome to the CodeCast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the CodeCast podcast today. My name is Terry Fletcher. Welcome to May. I think we are all surprised that we're already into the 5th month of 2024. But I wanted to talk today about a topic for urgent care centers that I think happens when you have also a primary care provider practice tied to an urgent care center or even a specialty practice. And I just want to keep you on the straight and narrow because there seems to be some confusion on when you are elevating service to the ER or to the hospital, and you're elevating it because of lack of testing facility or equipment or something to that effect, and it's more of a fact-finding mission instead of really doing it because the patient's decision of their diagnosis has a high risk factor to it. It's just that maybe you don't have an MRI, or you don't have a CT scan, or you don't have, certain X-ray type machines or something like that you can get what you need as far as more information, but it's not because you suspect the patient has appendicitis or because you suspect that the patient has a brain injury. It's that you just don't have it, and you're just like, okay, just to be on the safe side, or just to make sure that we're not seeing this, that you're sending the patient over to the ER. That isn't necessarily what we call medically necessary to elevate that urgent care visit to a level 5. And you're going to have a really hard time getting that through any kind of an audit if that's something you try to do. And I'm going to apologize in advance. I've started this podcast over a couple times because, of course, they're picking up our trash outside my window, and the trash collector has very squeaky brakes. And so I'm just like, you've got to be kidding me. How come that only happens when I'm recording? It never happens when I'm just sitting here by myself trying to work. No, it happens when I'm on a recording. Yeah, okay. It's just welcome to my life. But anyway, let me move on here. So here's what happened. So the patient came in, they had abdominal pain, and they did labs in the office. Everything was negative. There was nothing they were even worried about. They did even a UA. It was clear, yellow, nothing, no issues with cultures. But they put in their medical decision, discuss with patient that we cannot perform adequate testing for abdominal pain in the urgent care. We can draw labs, but it would take several hours. And we believe the patient needs labs and potentially further investigation. But we say don't eat or drink anything else today. So then you go down to the summary at the bottom, and it says complexity of problem at presentation high. Now this is a 23-year-old patient with no issues, no any kind of comorbidities. It says at presentation, the differential diagnosis considered could be potentially life-threatening or risk to bodily function. And says patient sent to ED to rule out potentially life-threatening causes of abdominal pain, not limited to appendicitis, pancreatitis, diverticulitis. But then the patient drove themselves over. There was no transportation needed for the ED decision. Patient decided they're going to go home first. Even said patient's going to run home first just to pick up an additional, what did this say here? Additional shirt because she didn't like what she was wearing. And I'm thinking, wait, okay, so far I'm not seeing anything on here that shows that this is anything but a patient that has an undiagnosed new problem, which is moderate, and it doesn't show a threat to life within the documentation. The provider is using language from the AMA CPT book that it instructs how to get to a certain level. It doesn't have anything to do with the patient's presentation. They did point of care labs, which again, those are low to moderate. And then the assessment of risk, patient sent to the hospital not because of a concern or life or death, but because they have inadequate testing options at the urgent care center. And again, they weren't transported by ambulance. They just recommended to go to the ER for further testing. And to me, that's moderate until you know. And if the patient was experiencing, bleeding or sepsis, or they had something that, they had a temperature, nothing like that. So there was nothing to say that they had the possible appendicitis or pancreatitis or anything like that, because there were no symptoms that supported that. It was just documentation to try to boost the level of service. So you have to be really careful, because if you have anyone instructing your providers to use language that's just part of the AMA instructional guide and not part of the patient's actual condition or even potentially possible condition, then you're going to have a really tough time. And when realize that the physician says, well, we don't know what's ongoing with the patient because it's just pain, abdominal pain, chest pain, pelvic pain. So we're going to send them to the ED to figure out what's wrong. That's not going to be high risk unless the transport or the urgent need to get the patient to the hospital. And again, some of the sign or symptoms, that is part of the entire profile that day of that patient. Did you find that they had a temperature? Are they nausea or vomiting? And this was all negative. There was nothing that indicated this. It was more precautionary measures. And so, you don't have to call for an ambulance per se, because that can be costly to the patient. But if the patient is in such a state where they can put themselves in jeopardy and drive themselves, even with the person accompanying them, but there's no sign or symptoms except for just pain, then that you're going to have a hard time supporting that level 5. I would actually code that as a level 4. And it's just kind of like sending a patient because they don't have insurance to cover their meds, so you have to find an alternative. That's administrative. It's not considered high risk. It's administrative, and that actually speaks to potentially social determinants of health. So be careful when you're automatically going to high risk, because that could be considered fabricating records if you're not clear. And remember, in 2024 there was something added to the number and complexity of problems addressed under low that said one acute uncomplicated illness. And again, if it's just pain, you don't know yet if it's complicated. It said or injury requiring hospital or observation level of care. And so that's even under low. So to get to high, you have to show that there is an inherent life threat risk, that it's there. And if there's no other sign or symptoms that contribute to that decision, then it would be really hard to make that leap just because you don't have the equipment to get there. So be very careful with that, because I see that happening every once in a while, and it's a very dangerous way to level your service. So as I mentioned at the beginning, this was going to be a shorter episode today. I just really wanted to kind of get that off my mind, since we did kind of a longer version of the Top 10 Tuesday last week. If you hadn't had a chance to listen to it, please check that out. A couple of things happening for me in May. Wanted to make sure that you had that on your schedule. I'm speaking at the NAMIS virtual conference. I'm doing a team session with Stephanie Allard on telehealth integration. And really, it does have coding and tied to it, but it's really, should you be putting it in your office now that a lot of those platform companies have actually gone out of business? Now they're saying that less than 5% of encounters for patients are telehealth or virtual. So we're going to just talk about that and see what your options are. So that is on the 15th of May. Make sure you check that out at namis.co. Also, many of you have been asking about coding and billing and compliance questions. Again, please go to my website at terryfletcher.net. Click on the drop down for services, and the very first one is our Coding Corner membership. We have over 100 people that are 100 practices, I should say, that are part of that. And you just can get unlimited coding questions through emails and it's a year's subscription. So hopefully you want to be part of that. It's been ongoing. We've had this now we just hit 30 years. How crazy is that? So if you want to participate in that, we love to help you, and we can give you cited references. We help you with your appeals processes. We help you code if you have any issues there. And then you also get some discounts on auditing services if you need it. Also, if you're an executive member, which right now we're at half of our Coding Corner membership are executive members, we do a quarterly Ask Me Anything Zoom call. So you can just lurk. You can be on with everyone else that wants to be part of that, and just ask questions. So it's basically your call. So hopefully you can be part of that. And the reason that we do that is because I do get a flood of questions. I get at least 22. I've had one week where I've had over 100 questions. And so myself and my staff We work very hard for you, but it is a service, okay, because of all the time we spent doing our research and making sure that you get updated information. And the last thing, this is kind of a personal thing that it's not a tidbit for me, but it's just kind of a public service announcement. One of the things I was reading on the CDC website, and I always try to catch up on my published guidance around this time of the year, is that some of the sicknesses and illnesses that are coming out have to do with two things. And think about it. We're dealing with spring cleaning and doing all that. And people forget spring cleaning isn't just about refreshing your sheets and your curtains and, updating plants and things like that. Make sure that if you have water bottles that are plastic or insulated or anything like that by your bedside, or you carry one around, that you are absolutely cleaning and sterilizing it every day. And if you have an iPhone or an Android or any kind of cell phone, that you are also wiping those down and cleaning those off daily. So that shouldn't be something that you let go, because not only germs, but mold, but, carrying illnesses, airborne things can live on those things, and it's gross. So just make sure that, especially if you put your lips around anything with the water bottles, it can build up some disgusting things on there. So make sure you are definitely washing those down. And it'll keep you from not getting sick, hopefully, now that we're well into spring and hopefully headed toward summer pretty soon. Even though in California, we tend to have this really nice warm weather. And then like today, we are back to 60 degrees. So 65, actually. That's cold here because there's no sun out. But I have a little tan going. How cool is that? I'm an Irish woman, which means I get lots of freckles, but I actually have a tan going because we've been in our pool as much as possible, getting into my exercise and just keeping my healthy lifestyle changes up. So anyone who's asked, thank you for always supporting and asking about that. All right, everyone. Hopefully you have a good rest of your week. Make it a great day. And thank you for listening to the CodeCast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1, or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.